Morning, everyone. It's 14 minutes past 9 o'clock. Welcome back to a great day for this Wednesday. It's the first day of July and time now for some great smiles. Oh, yes, indeed. Plaza Dental Group is here. We have Chevelle Rice joining us at the desk this morning as we're talking about how to make you smile.
Yes.
How about that?
Yeah.
So we were just chatting a little bit off the air about something a lot of people, as you mentioned that today, a lot of laws go into effect. Also, a lot of insurance plans kick into gear on July 1st. Or change of
Oh,
some
they do?
way. Yeah, July 1st.
Okay.
Is when a lot of them change.
I should probably check my email.
The ones here changed today.
My work email. I saw that, but I was like,
it's boring. It's insurance.
It's insurance. I didn't really want to look at it. But speaking of insurance, when it comes to dental insurance, what can people expect? Or what are some things they maybe don't know about?
A lot of people don't know that dental insurance is actually a lot different than medical insurance. You know, a lot of people think that dental insurance covers everything and they don't have a copay, and that's not necessarily the case.
When I was a kid, it was.
Yeah.
Back in the
Really?
60s, it was.
Yeah.
We just went to the dentist, and that was it.
And that was
Lou
it.
just gave the doctor some canned tomatoes, and that was it.
And a couple
Here's a
of
couple
goats.
of chickens.
Yeah.
And,
No, but seriously, back in the 60s and 70s, that's the way a lot of those insurance plans work. But
Wow.
things have evolved since that time.
They have, and a lot of insurances, you know, have X amount of dollars that they pay towards dental work, and a lot of the times it's for preventive type of care, so getting your teeth cleaned and getting your exam and x-rays. But when people start to get into needing actual work done, like fillings or crowns, that's when insurance may not cover 100%.
Yeah, the crowns will kill you.
Yeah.
Yeah,
Crowns
it
and
can.
bridges. Yep.
Yeah, now it really just all depends on the type of plan that your employer may set for, you know, your specific dental insurance. So there are some plans out there that pay well, you know, maybe 80% of
Really?
certain dental work, but then there's some that are
You need to
like
go work there.
40%.
Yeah. Ours pays
so.
1% of whatever the work is.
seriously? No. I gotta read that email.
No, it's 2.
It's too. We're just exaggerating.
Well, and it's tricky because dental insurances don't cover that percentage based on the dental office's fee. It's a fee that they actually set, and it's called like a usual and customary fee.
The insurance people
the insurance
set it?
people, yes. So
Really?
yeah.
So if I tell my dentist to charge me $6,000 for a crown instead of whatever they normally charge to try to offset that, that doesn't work.
Yep, if a dental office is in network with a specific insurance company, then you know, even if you charge $6,000 for a crown, the insurance might say, well, you know, the maximum that you can charge is, you know, $1,000, and we'll pay 50% of that if you're an in-network provider for that insurance.
Okay.
So that's what patients, you know, tend to, you know, ask questions about is, are you in network with my insurance? And that's where us as a dental office will tell them if we're an in-network provider, out-of-network provider. But I mean, we, you know, submit to most insurance companies. It's just based on an in-network or out-of-network.
Now, what
benefit.
about folks that have kids, and maybe you're like a lot of us, we all had braces, I think, at one time or another. And what about braces and stuff for the kids?
Same thing. So depending on the insurance policy that they have, some insurances have coverage for orthodontics and some don't. So we tell patients, you know, ultimately they need to know their policy because that's all the information that your employer gives to you when you sign up for the plan. But we try our very best to, you know, check on their insurance and find out that information. That way then we can give the patient an estimate of what their insurance may cover.
Now, if a lot of policies don't cover very much, are there other ways of financing having work done?
Yeah, and I'm sure most offices kind of do similar things. So we work with a company called Care Credit, where patients can do like outside financing, where they can make, you know, smaller monthly payments versus paying something, you know, in full. So, and we always estimate what their patient portion will be, or, you know, their balance after insurance picks up whatever estimate that we can provide to them.
Now, what if somebody does not have dental insurance? Maybe they're coming in, they need something done, and maybe either they're not employed, or maybe they're employed, but the company isn't large enough to have any of that type of thing. Will you help them find somebody?
You know, we do. We actually, like, our office has an in-office savings plan, so it's not like dental insurance, it's more of a discount plan. That way then we can provide, you know, some sort of discount for people who don't have the insurance benefits. So
That's a good idea.
So there's some
Yeah.
options out there, because I feel like a lot
Right.
of people, besides the dentist, not always seem like a glamorous place to go, although we learn it's not that
bad of a deal, yeah.
It's actually a
Yeah.
great thing, and it's a big part of your health. But are people worried? It's like, I don't know if I can afford it, or I don't know what the sticker shock's going to be.
I think a lot of patients are. I mean, I think because insurances don't cover 100% of everything, or because they may not have insurance, I think it potentially does limit people to go to the dentist, which is unfortunate. But you know, dental health is just so important. You know, it doesn't just stay right here in the mouth. You know, it's systemic, so it can, you know, affect your whole body.
Yeah,
So-
Dr. Stephanie talked a little bit about that last time she was
Right.
here, how it does affect your entire body.
Yeah.
So if you have something going on, don't be afraid of the dentist. Stop over and visit with them, because you can help them work some stuff
Yeah,
out.
there's some options out
Exactly.
there.
Yeah, there's always options.
Here's where you can find Plaza Dental Group, folks, over on Jordan Creek Parkway, Suite 100. Just stop by and visit them right off the interstate, easy to get to. So just stop by, and then, as Dr. Stephanie says, after you go to the dentist, there's a frozen custard joint right next door too. So you have treat yourself when you're done.
Yeah.
So